Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On March 17, 2026, the US FDA granted a oral peptide approval for icotrokinra for the treatment for moderate to severe plaque psoriasis in adults and pediatric patients aged 12 years and older who weigh at least 40 kg, which is 88 pounds, who are candidates for systemic therapy or phototherapy. Now, let's dive into this medication in more detail. icotrokinra, brand name ICOTYDE. This medication was approved by the US FDA on March 17, 2026. And indicated to treat moderate to severe plaque psoriasis in adults and pediatric patients aged 12 years and older who weigh at least 40 kg, 88 pounds, who are candidates for systemic therapy or phototherapy. ICOTYDE approval represents the first and only interleukin IL-23 receptor targeted oral peptide therapy. Plaque psoriasis is an autoimmune disease affecting over 7 million people in the US. Chemically, icotrokinra is a synthetic macrolide peptide containing 13 amino acids. The molecular weight is 1,898.17 grams per mole. This medication is available as the hydrochloride salt form and 200 mg as tablets. Recommended dosage 200 mg taken orally once daily, taken on an empty stomach with water upon waking, and wait at least 30 minutes after taking ICOTYDE before eating food. Mechanistically, icotrokinra works as a selective interleukin-23 IL-23 receptor antagonist with a binding affinity KD value of 7 picomolar, blocking the IL-23 receptor dependent release of pro-inflammatory cytokine. Pharmacokinetically, Tmax, the mean time to reach maximum concentration of icotrokinra is 2 hours. Taking icotrokinra with a high-fat meal decreases the drug exposure over 40%. Therefore, this medication is required to be taken on an empty stomach. Protein binding is 52%. The apparent oral volume of distribution at steady state of icotrokinra is 92,800 liters, indicating extremely high distribution into tissues. The median elimination half-life is 12 hours. Metabolism, given icotrokinra is a 13 amino acid peptide, it's metabolized into small peptides and amino acid by catabolic pathways. Excretion within the first 24 hours in the urine 0.001% as the parent drug molecule, in the feces approximately 37 to 81% as the parent drug molecule. Therefore, icotrokinra is mainly excreted in the feces. Drug-drug interactions. No formal drug-drug interactions have been performed, and no clinically significant drug-drug interactions are expected. Contraindications. Currently, there are no contraindications listed on the prescribing information. The most common adverse effects greater than or equal to 1% for ICOTYDE include headache, nausea, cough, fungal infection, and fatigue. Here are the key references which I have used to prepare for today's video. The US FDA new drug approval updates for 2026 is a very valuable resource. In addition, most of the medication information which I shared today is based on the ICOTYDE prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.